Today we're going to be hearing about Kalaniyot, a terrific faculty-led initiative at many leading U.S. universities. This initiative, Kalaniyot, seeks to advance academic excellence by deepening ties with Israeli scholars and building a supportive campus community. We have as our guest one of the key people in Kalaniyot, Mark Poznansky, who's a professor of medicine at Harvard Medical School and the director of the Vaccine and Immunotherapy Center at Massachusetts General Hospital. Welcome, Mark.
Thank you for inviting me.
Mark, please tell us a bit about yourself and your background, and then I'll ask you some questions about Kalaniyot.
Well, I'm a physician scientist. I trained in the UK, actually in Edinburgh Medical School and then Cambridge University, where I did my PhD, and then came back and forwards between the US and UK practicing and training in medicine until I ended up a Mass General for the last 25, 26 years. I've been involved in developing vaccines and immunotherapies for cancer, infectious diseases, and immune-mediated diseases like ALS. More recently, I've also got involved in supporting the Jewish community in academia in Harvard Medical School, particularly since October the 7th, when it became apparent to me and many of my colleagues, Jewish colleagues here, that this type of support system, both for the Jewish community and for the Israeli community, was really essential.
That's great. So tell us a bit more about this support system that you have there.
So for the Jewish community here, which includes Israeli healthcare professionals, which is sometimes, I think, forgotten, there are a lot of Israeli employees in the system too.
Well, those of us who lived in Boston know that there's a lot of Israelis in the medical area in Boston, and it's a wonderful thing.
Yes, it turned out they needed support, mostly in terms of just a community. After October the 7th, there was a lot of feeling of isolation, ostracization, being somewhat gaslit by some members of the community around them that, nothing severe was happening, or worse, that there was somehow Israel was to blame for October the 7th. And we wanted to provide, in a healthcare setting, a supportive, healing community. And it really took hold, and we gained over 500 members very rapidly, and then provided listening and support sessions and the ability for people to share their experiences and address those experiences where necessary with healthcare management to make sure that Jewish and Israeli staff felt comfortable, as they should do, and they were entitled to, working in a system that was centered on healing for all. And I think that was what was achieved. Now, at the same time, I was growing acutely aware of a sort of unofficial academic boycott of Israel and things Israeli, which again in medical science and the healing sciences is just sort of unheard of. I mean, we're all working for the greater good of all humanity, regardless of race, national origin, or religion, or anything else, gender, you name it. And so the idea that one country would become isolated from that process in which healthcare could be educated, advanced, patient care improved, just seemed anathema to me that should be happening. And myself with some wonderful colleagues here, and I'll talk about this in more detail, but Professor Matthew Meyerson and Professor Naama Kanarek and lately Professor Galit Lahav formed up this group for a Kalaniyot chapter of Harvard Medical School. The overall umbrella initiative was led by two amazing professors at MIT, Professor Ernest Frankel and Professor Rosen, who just were amazing, and we wanted to create this for our medical school to overcome this isolation of Israeli biomedical academia from the rest of the world's academic system in a small way with Harvard Medical School.
What are some of the things that you did besides creating a warm community, which of course is vital, but what beyond that?
I think in terms of Kalaniyot, the big things were to establish a funded postdoctoral research program between Israeli biomedical academics and Harvard Medical School academia that now funds 4 Israeli postdocs to come to Harvard Medical to study for 2 years with ample financial support both for themselves and their families. And that's very important. Then the other thing we're setting up a fellowship for clinical doctors in Israel to be able to come here for 4 to 6 weeks to Mass General Hospital or Brigham and Women's Hospital to do observerships and training in specific areas of interest. And finally, one of the things on the launch pad is to do the same for Israeli medical students to come here for elective observerships in areas that they're interested in. So that really sums up what Kalaniyot does, and also, needless to say, brings, in a way, publicity to an ongoing Harvard Medical School Israeli biomedical collaboration when this sort of unofficial academic boycott is trying to silence all of that or negate all of that.
That's terrific. And my guess is that Israel also has a lot to offer besides receiving from the
Yeah.
brilliance that you have at Beth Israel and Mass General and at Harvard and even at MIT, right? It could be a two-way street.
There's some of the institution, biomedical research and hospital systems in Israel are some of the leading ones in the world. Well up there in the top 20, 30, even top Weizmann Institute is in the top 10 of international renowned research institutes, offering knowledge to the world in everything from water purification to treatment for Alzheimer's disease. Why, I guess my thing is my naive befuddlement that people would actually want that to be curtailed simply because Israelis were involved in it. It's just, as I said, both counterintuitive and quite appalling that that could be contemplated from my point of view.
Do you have a sense that things are getting any better now that the intensive fighting is over and the food situation in Gaza is getting better? Do you feel any improvement in the atmosphere?
The short answer between myself and my colleagues, and I've made many, many wonderful new colleagues and friends as a result of all of this here, is the answer. The simple answer is sort of basically two letters, and that's no. I would have loved to have said yes, but it hasn't. And there has been a theme, as we've seen in politics, of doubling down, and one gets the feeling that there is a doubling down on the hostility, even though, as you said, there's a ceasefire. The situation in Gaza has stabilized to some extent. It's still an appalling situation, but nevertheless, motivation to continue the drive both on anti-Semitism and toxic anti-Israel sentiment has continued.
What can we in Israel, whether it's the health system or the health system leadership or even the political leadership, what things could we do that would make the situation, the transfer of people and knowledge in healthcare, in biomedical research better? What could we do to improve that?
Well, it's an interesting thing that all of these events of the past couple of years or more have thrown into context, is that the Jewish diaspora need the Israeli state, the Israeli state and the state of Israel and Israelis as much as the Israelis need the diaspora. And I tell a little anecdote, which was when I was little, visiting Israel in the 70s, I would say, there would be a common thread of Israelis telling me, why don't you move here? Move here. And there, that's a continuing sort of thing. But I actually think the strength of the Jews is the power of both the combined power of the diaspora with Israel, and Israel understanding that, per your question, I'm not making any political point here, per your question, that deep connection between diasporic Jews and Israeli Jews, and Israel, the nation, the multicultural, multi-ethnic, multi-religious nation, is actually really important to both sides' continued thriving and existence. And I think the governmental roles in Israel emphasizing that and supporting it is really valuable. And I think this whole situation's thrown that into spotlight. That relationship is important.
Absolutely.